Once you start feeling better, and then every little thing which goes wrong in the body is because of this pill, which is anyway not serving me anymore. So every time when patients come and follow up, in fact, you come to know only 6 months later that they've stopped treatment, unless you specifically ask whether you're continuing this medication or not. If you don't ask that question, they'll say, "No, doctor, Sahab, I stopped 6 months back because I was getting backache." I said, "How do you know that this is because of this?"
Hi, my name is Samara Mahindra, and I am the founder of Carer, India's first integrative oncology solution. Cancer, unfortunately, is becoming the leading cause of death worldwide, accounting for 10 million deaths in 2020. But it can be healed, and that's why we're here today. I would love to present you the first integrative oncology podcast being broadcasted in India today. Over here, we interview renowned medical professionals in the field of cancer to understand how we can treat and heal cancer effectively. In this episode, I introduce you to the renowned surgical oncologist, Dr. Harit Chaturvedi, Chairperson of Max Cancer Institute. We have an in-depth discussion on cancer treatment, general health, and symptoms that we can look out for to prevent cancer. If you are a caregiver or a cancer patient going through cancer at the moment, then this is an episode you don't want to miss. Dr. Harit Chaturvedi, it is a pleasure to have you here. You are a pioneer when it comes to oncology and cancer care in India. So I am going to first start with the most important question. If you can shed a little bit of light on the advancements and evolvements in cancer care and oncology today.
So, first of all, thank you very much, Samara, for having me here, because I think what you are doing and what I am realizing is happening all around. I think we all need to really work together to bring the very best for our patients and for the community at large. And I think every stakeholder really needs to put our best foot forward. And as you would have seen, and everybody is realizing gradually that oncology is the new cancer word in the medical community. So what was happening in cardiology in 80s and 70s is happening in oncology today. So there a lot of advancement took place in that era, and the result of that was that in 90s and 2000 the fear of cardiac events actually went down rapidly. We are seeing the same spectrum spanning out in oncology world, and every aspect of care, whether you talk about understanding cancer in terms of prevention, whether we talk about screening or early detection, or even when somebody is diagnosed with cancer, the understanding and mapping of cancer as we do today is very much different from what it was done in even 20 years back. So every aspect of uh, treatment has changed, every aspect of care has changed because of better understanding. Today, for example, in terms of treatment, we have precision in every which way. You talk of surgery, even there we talk of precision, the minimally access surgery, the robotic surgery, all this is, or picking up sentinel nodes and preventing what we say today is where less is more, that you to pick up a sentinel node and it has the same effect as it is for a radical lymph node dissection, because you pick up one node which is the most representative node and you dissect it too much in detail and get a much more information from that single node than you would get in a full nodal dissection, things like that. I'm just trying to say that every aspect of care has changed, from prevention, early detection, diagnosis making, treatment, and even palliative care for that matter. Every aspect has changed. And if I have to take examples, I would say that today we all realize that almost 50% of cancer is preventable. So I think this is one point which want to harp whenever I get a chance, that almost 15-20% is lifestyle related today, which is diet and other factors, just the way we live, the obesity, you say, or our exercise regime, or exposure, or even I would say the management of sleep and day night management. All these things have changed a lot. So 15-20% is because of that, and another 30% odd is because of tobacco and certain dietary factors. So much is preventable. If we just focus on this, it will get off the table. Then today, almost on the verge of getting into the market are tools which are for screen detection. That is single blood tests, which can help you pick up early diagnosis of cancer. Now, Most of these tests are not so well validated. They're around the corner, but a lot of work has happened in last 10 years in this space. And I'm expecting that very soon, maybe in a couple of years, we'll have some very strong data backed information where we can take identify patients who need more investigations for treatment, healthy population, not patients. And likewise, once a cancer is diagnosed, the understanding of cancer, whether you do a molecular study, genetic study, so NGS is something which was generally done earlier for palliative care and advanced cancers. Today, we talk of doing the test at the time of diagnosis. The whole idea is that if you can pick up, identify the molecules, use that for precision treatment, maybe the patient is saved of so many side effects and so many unnecessary treatments. So all this is into play, and we all know it will take some time to play out fully, but a lot of good things are happening. And if I can also say, one big thing which has changed is the attitude of people and also attitude of the clinical teams. Today we are more open-minded. We know so much is changing, so we discuss more often than before. And the concepts of tumor board, multidisciplinary team working together, all this has become part of oncology culture across the country and maybe across the globe. So I would say majority of the centers today have these things very well embedded, and they work very closely to find best solutions for each patients, and a seamless care is provided to our patients. So every aspect has changed, I can say that.
So, Dr. Harit, tell me a little bit about the misconception when it comes to oncology and cancer and the fear associated with it. You very rightly spoke about cancer in comparison to what cardiac used to be. And today we're looking at cancer as more of a lifestyle disease, one which is chronic and one which is very manageable and preventable. Lot of the stigma, I believe, is associated with miscommunication or just misinformation about cancer and the fear associated. What can you say about that, and what can you tell people out there when it comes to the fear of cancer?
So endless myths. There are endless myths.
Yes.
Every day I'm bounced with a new question which I have not heard before. So I keep wondering that all these 30 years, still there's more to realize that people have. So some very common ones I'll take which come up straight away on my mind is that diagnosis that you they don't want to be put touched by a knife or a needle because then the cancer will spread. So I keep talking about it that if this was true, then we can't make a diagnosis because tissue is an integral part of diagnosis, making understanding tumor. And if this was true, everybody who has not had a needle or a puncture would have come in stage one. So most of the people who are delaying the diagnosis actually are losing the opportunity or the window to treat for treatment. So that is, I don't know why, but it is not getting over. This question is perennial. This is just ongoing. Then one big myth is about chemotherapy. Chemotherapy has side effects. So everything has side effects. The treatment is something where the benefits outweigh the side effects, and that is why chemotherapy out there is helps in saving so many lives. So unnecessary treatment of any kind is not good, whether it is cancer or non-cancer. So we're not talking about things that are not required. I'm saying anything which is scientifically validated, recommended, should be assessed and then wholeheartedly adopted because only then you'll get the best out of it. And regarding radiation therapy and surgeries, that it causes weakness, and so I keep telling people that the weakness is not because of the intervention, weakness is because of the cancer. The disease is causing the weakness. So if you control the disease, the patient or the host body improves. So these are few of the So there are a lot of myths around regarding every aspect, diagnosis and interventions. CT exposure will be radiation exposure. Mammography today will cause side effects. So mammography of 20 years back and today is far different. So it is much more advanced technology, much less radiation exposure, and much detailed analysis. So digital mammography gives a lot of information. So likewise, I think what you said, the fear factor is what plays so much that every negative thought is captured, is allowed to play out, and so that negative thought is what kills the opportunity. So I think we have to really, I would not say positive just for the sake of being positive, but be open minded to absorb all the information. And today, fortunately, there are various methods to get your facts checked. So
Yes.
it's not that you have to listen. Dr. Harit will talk about the gospel truth, or this is where all the information comes from. So it is that we have to be open minded. You go and check. You can take second opinions from two, three well established centers and so many. So what happens when you do some checking out, you will get a filter and get a sense of what is the right way to go about it.
Absolutely. And Dr. Harat, we are moving to more, I mean, you spoke about a multidisciplinary approach, and we're moving to a very holistic way of treating cancer, a more patient centric approach. According to you, how are we moving in that direction, and what is patient centricity for you and your patients?
So, so as far as patient centricity is concerned, I think what we have seen a huge transition has happened. Quite, it was not uncommon for a patient about whom the treatment is being discussed without the patient in the room
Hmm.
and without involving the patient. Even there was a time when even the family would say, "We are not going to tell this person that
Yes.
you are going to have this surgery, cancer surgery." We'll say, small tumor has to be removed and something of that kind. So, not sharing the right information and the full information with the patient is is not acceptable today. How we handle it, what are the professional ways of doing it, how to involve the family and caregivers and make sure that the full information is fully shared, understood, absorbed, and then patients' own concerns and priorities have been listed and understood. Then we can take a call what is the best treatment for the patient. Now, this can play out in every part of the body, whether we talk about breast conservation versus mastectomy, whether we talk about colectomy in a Lynch syndrome, whether doing a partial colectomy or total colectomy, or in a uh, FAP or ulcerative colitis or whatever. So there are various situations in which we have to take a call that there are two ways to treat or two options available. What we would prefer, and this has got these positives, this is got these negatives, and that decision making process is what is patient centricity, that the information is fully shared, timely shared, and shared with the caregivers also so that everybody is on the same page. And then we take a call based on patients' preferences, priorities, way of thinking and living, and what suits best for that age and for that person. So I've had 80-year-olds who have said that I want breast reconstruction. So
Wow.
for me also it comes as a zap that, oh my god, at 80, then they would say, what would you suggest? So I'd say, see, it's your choice, but I am slightly hesitant in extending your surgery beyond an hour or so. So these things too get discussed. But I'm just saying that the mindset has shifted a lot, and people want to be to know everything, and that's a good thing.
That's fantastic because Dr. Arit, when my own mother was going through treatment, this was many, many years ago, over 10 years ago, we just followed suit of what the oncologist said, and we just, we asked no questions. We weren't really involved in the treatment regimen, and we followed blindly. But today, when we work with patients, it's a whole different ballgame. Tell me, how much does involving a patient in the journey of whatever their treatment regimen is, how important is it for their outcomes, their quality of life?
If the patient is not involved, I can guarantee that more often than not, you will not be able to deliver what you want to deliver, because there will be lots of ups and downs happening during the journey. So, if the information is not complete and not shared, if you are not sharing, I can tell you the patient will also not share.
Mm, true.
So, the gap widens. It is very important to build a relationship where you enter with a smile and open up the conversation, that the patient also opens up.
Very
This
true.
whole game is partly, I would say it is a one has to build that personality to actually be proactive in making that conversation happen. So many of my patients complain also that so and so is not talking or is very reserved and all. I feel in the field of oncology, it's not the amount of time you give to the patient, it's about the quality of time you give to
True.
the patient. And that quality of time happens by your opening sentence, by your setting up the context. And once you start from a point where it is a factual, including with a sense of hope, with clarity. I'm telling you, my sense is that people talk very freely, frankly, and they're able to even discuss life and death issues. And people even ask me about when they want to write their will and all those things. So I actually feel that that relationship happens in very, it doesn't require time. All it requires is a good quality, open conversation,
Absolutely.
and that
Absolutely.
is critical. That is critical. So to say that how important it is, I think without having good relationship, one cannot deliver quality treatment.
Absolutely. Dr. Harit, I'm going to talk to you about something very important, which is integrative oncology, which is using various complementary non clinical therapies along with conventional treatment to improve patient outcomes. What is your thought on integrative oncology? And if you can tell our audience a little bit of what integrative oncology even is.
So when we talk of oncology today or cancer treatment care or this thing, it is so for, I would say, for decades, few things were almost around there. They were, for example, physiotherapy was very much part of it. Now, physiotherapy has moved beyond physiotherapy. We are not just saying that the side effects of treatment or those things are well managed. We are saying that you are back to the society with full energy, full throttle. So that state of body and mind doesn't happen by physiotherapy alone. So that requires a different level of confidence and addressing every little concern which the patient or the family would have. Those things are critical. So I think quite a few of these. For example, if we talk about taking care of one's confidence or psycho-oncology or balancing that. So, for example, we in our department have had a psycho-oncologist for 12 years now, right from the beginning. We always believe that it's integral. For example, palliative care is part of our program for more than 5 years, 6 years. So all these things have been round there, and gradually they're evolving, developing, getting integrated, and and taking shape. And all this is finally giving better care to our patients, and making sure that the treatment does not mean end of cancer alone. It also means the person is where they started when they were healthy and fit,
Yes.
so that their life. So one of my beliefs is that your life after cancer treatment gets 10x. What was 1x before gets 10x, because then you start valuing relationships, you start valuing time, you know the opportunity you have here on this earth, and so you want to give back and you do more, and so whole ball game changes rapidly. So I would say that in this journey from 1x to 10x, the support you require, the support you get, and that support is from professionals who are providing your support in terms of psycho-oncology, you're managing your mental health, or managing your transitions during difficult times, or even giving you an insight of what more is lying for you in the future post cancer treatment, so to say. And from your body perspective, your physio, rehab, and proactive taking care of every aspect of your normal day to day routine. And for example, now diet is becomes so important. It is unbelievable that it is supposed to be another pillar of cancer treatment, and that is where it is coming. So it's not just for cancer, as I am realizing that all of us have a DNA, and that is one fixed thing which is not, you can't change that. That is something you inherit. But that is something which is in your control. Your exercise is in your control,
Absolutely.
and you play out with these things, and you can actually have a very different life. Same DNA. In fact, there's some study going on in UK with 15,000 twins, and they are studying that how their life pans out and what is the role of diet and other factors in terms of disease and health. So I think very exciting times. A lot of data will come in, and we'll know more. So integrative oncology is actually integrated very well into oncology care. I think no oncology care is complete without having all these things as part of the program, and not just in hospital. It extends beyond till the patient is actually fully back and enjoying life once again. Till that point, this is very much very well integrated. In fact, um, there are some studies also where yoga and other things, acupressure, have proven to counter the side effects of chemo and other things, and given patients much faster recovery, and appropriate treatment could be given because of that. So a lot is happening in that space, and I think diet is another area which has unbelievable potential. I think very soon we'll, in next couple of years, there are a lot of information which is coming, a lot of studies going on. So we are also part of one study where our patient's diet and stool is getting tested, and the microbe,
Yes,
the
microbiome. Yes.
gut, yeah, gut is being studied, so that all these things will give insight. So amazing opportunities to partner.
So, Dr. Harit, how much of a role does integrative therapy? So, when I speak about integrative therapies, as you mentioned, I'm predominantly speaking about personalized clinical nutrition, physical rehab in the form of physiotherapy and yoga therapy, and then, of course, mental well being like psycho oncology. How much of a role does it play in your practice? And how have you seen your patients improve in the with the inclusion of these therapies in comparison to those who have not included an integrative approach in their treatment?
So I would say that I can't give a comparative. I can only say from my experience that so we have been very fortunate at Max that our institution has always believed into a comprehensive, holistic
Yes.
approach, and so whenever we asked for these things, they were never something which was not considered important, and so let us focus it on this later on. It was always there, and as I said earlier, that we have had a very comprehensive approach, especially for example, psycho-oncology. Today we have Hiba, earlier we have somebody else. So we have been having somebody supporting this program for more than 10 years, 11 years now, and it has given us huge rewards. Our patients require support. Our support group is one of the most active support groups across the country,
Wow.
where patients support each other,
Yeah.
and they are amazing WhatsApp groups. So a lot of that stress is taken away by these people, and likewise we have people in almost all centers at Max where we want to integrate that at the same level. So I would say that coping with this journey for cancer patients by the clinical team is not always possible, because we neither have the capability, technical training, or bandwidth, nor we have the time. Both the things are at a limitation. So if you have interest, you can go deep dive and pick it up. But you have interest but don't have time, you actually never spend time with it.
True.
So you never grow that muscle, and so it always remains a weak area, and there'll be a bad days and there'll be good days, and so people can't be at the mercy of your good days and bad days. So the professional environment has to provide that opportunity, and therefore I think I would say I believe that no cancer care is incomplete without integrative oncology, well integrated in all clinicians' minds, not just having it in the corner of the room, but it should be part of our discussion, it should be part of our program, and every patient should know that these services are available. Only then they are able to utilize it.
And it's so encouraging, and it makes me so happy to hear you say this, because there was a time where, of course, there was skepticism. There were a lot of oncologists who weren't propagating this. And then we have, oncologists like yourself who are out there talking about this, and pushing for patient care and patient centricity and integrative oncology. How do we encourage a wider adoption of this, Dr. Harit, in a country like India?
I think it's bound to happen. It will take time. So these are all, I would say, socio-economic issues,
Mm,
social as well as economic.
mm,
So few things take priority because it is a life and death in that moment.
true.
So while I'm saying that no oncology care is complete without integrative oncology, but if you measure in terms of saving lives, and you want to say, okay, topmost in solid tumors will be surgery, at least have good quality surgery, even that will save lives.
Mm,
Then you have this specialty, then you have a radiation facility, you have a comprehensive pathology, radiology. So if you look at that spectrum, where if you have 10 rupees, where will you spend?
mm,
So will you spend in these five areas? Then this will come on table. Then so it is both social and economic. So what you and me are doing right now by talking and putting it out there is improving the awareness level, that okay, people will realize the value, few people, more people will latch in and they will talk and they will discuss, and like that the message keeps going out, and and hopefully it will become a better world. Every day it will become better than yesterday, and that's how it will move. So it's both socio-economic in certain areas, certain segment of population. It will take its own time to come. I know this. Whatever we talk, when people can't even get quality targeted medicines, expensive drugs, so who will talk about integrative oncology? They just want the basics to be sorted. At the same time, every step will finally impact the whole environment, and it will keep going. So all that I think is a journey, and it's always going to be in transition whatever we do. But the faster adoption will happen with more and more engagement, more and more understanding, and taking out the examples. As I know that you're doing some studies and you got some data, so sharing that information.
Yes.
So nothing is more valuable than the evidence that this is what has
Absolutely.
happened.
Absolutely. And you
So evidence.
rightly, yes, and like you rightly said, it's up to us who are in the healthcare fraternity. Of course, you as doctors and those healthcare providers, healthcare companies that can actually push this forward and actually talk about it and encourage a comprehensive integrative approach for cancer in India. I wanted to ask you a question that just popped up, which is regarding patient reported outcomes. As you mentioned, there are a lot of trials and pilots and data that is being done on cohorts of different cancer patients. Now, of course, we have the clinical data and the medical data, which is an integral part, but we are noticing a lot of non clinical parameters becoming a part of these trials as patient reported outcomes. So those that affect quality of life and other parameters that can really improve or decrease the outcome of a patient. What are your thoughts on patient reported outcomes, and how important do you feel these data sets are for the overall trial of a drug or patient outcomes?
They're important, they're critical. I would say I will give them a lot of importance, because without, finally, what is our aim? Our aim is to have a holistic, complete treatment, and the person will, rather, I would say the person is not just treated but fully energized and back in the society and all that. So I would say the only way to measure is, unless you look at quality of life, just having the person 50% out there is no good.
Yeah.
If you can make it 70%, please work for it. If you make it 100%, please work for it. So where do we stop in our own desires is where things will stop. If we don't imagine and don't think, and so if we look at data and look at evidence, then we'll take that leap, that okay, do this because this will give this result. So this is how things happen. In fact, the whole world or the humanity or the science is progressing because of our inquisitiveness to do more and find out more and find answers to everything which is out there. So I think all this helps. Everything helps.
So I'm going to ask you a question, which is, it's an impediment for us in India and I guess globally, which is treatment adherence. We see a lot of dropout or delays in treatment regimens. Now, personally, what we have experienced is, because one of the things that we do focus on is response to treatment and improvement in treatment adherence. We see that there are multiple factors that affect treatment adherence. I was, shocked to know that a very big factor was just the negative connotation that a lot of Indian patients have towards allopathic treatment. So as soon as they start feeling better, they think it's better to be off the medication, and then sometimes they indulge in alternative treatment or don't take medication at all because they think that being on the treatment is worse for their bodies, right? So that's one of the things that was a very interesting, something interesting that I actually experienced. But I wanted to know what you thought of the important factors that affect treatment adherence and what can we do to improve treatment adherence.
So this is not just an Indian phenomenon; it's a global phenomenon. This dropout things. For example, hormonal treatment in breast cancer.
Yes.
So that is a lot of data there that almost 30-40% patients do not complete treatment. So this is in developed world as well, because once you start feeling better, and then every little thing which goes wrong in the body is because of this pill, which is anyway not serving me anymore.
Yeah.
So every time when patients come and follow up, in fact, you come to know only 6 months later that they've stopped treatment, unless you specifically ask whether you're continuing this medication or not. If you don't ask that question, they'll say, "No, doctor, Sahab, I stopped 6 months back because I was getting backache." I said, "How do you know that this is because of this? How do you assess?" No, this was unnecessarily going on. I'm fine now. I'm done. So this is very, very, very common, unfortunately. And as I said, almost 30-40% patients interrupt treatment. In fact, lot of studies on chemo radiation followed by surgery protocols in rectum, in esophagus. We all see dropout rates because once the symptoms go away, acute symptoms go away, people want to avoid surgery. And then the biggest question is they will quietly do a PET on their own and they'll say there was no tumor seen, so no treatment taken.
Mm.
1 year later, when the whole thing is back with vengeance, then you can't do anything, they can't do anything, we're in soup. So treatment adherence is a challenge, and getting treatment when you are in problem is something which is comes naturally. Once the symptoms go away, even I would say that taking antibiotics during infections. How many people complete the full 5 day course or whatever? 2, 3 days, 4 days. Once you're better, it's all gone. So same thing for prevention of cancer. So all of us know that tobacco is harmful, this is there, that is there. But how many people adhere to that understanding? Because it's not sexy to leave this. It is more attractive to have expensive tests and this and that and then and get diagnosed. That is different. So this is a very, very big problem, and not just for cancer. It is for, I think, healthcare as a whole. The treatment interruptions here, because it's a long drawn treatment. Therefore, see this more often, and this people get exhausted, people get fatigued, and they need support. So if there's no support of this kind, then nobody's bothered, and once they're feeling better, they get off. Now, to say that how to manage this, I think we have to work as a team. The caregiver, the medical fraternity, we have to work as one team to understand the importance of this treatment. And that is, there's one thing which I always believe, that every time a transition from one therapy to other therapy happens, there should be a joint meeting,
Yes.
that a patient should know before starting treatment that your treatment involves this step, and this step. And once you step number one is over, before you get to step number two, again a conversation happens in that same mode. By this, if you put these questions at that time, probably those fears will come out and probably will have answers. But if that doesn't happen, then there's a problem.
True. And you also mentioned, Dr. Harit, a very important point. You said the kind of communication and information that is expelled to the patient at the initial touch point and a contact with the patient is imperative. And you're
Very, very.
absolutely right, because that also sets the base for how the patient responds to treatment. And we have seen this time and again. The amount of information the patient has and how empowered they feel, and how the richness of their knowledge about their treatment journey, about their cancer actually makes a huge difference on how they even respond, and then actually sticking to the treatment regimen. So you're absolutely right there. We have seen it firsthand in what you've just said. I'm not going to take too much more of your time, but I'm going to ask you one last question, which is, as you said, we all know that early detection, screening, and prevention is the answer to witness somewhat of a cancer-free country. How do we encourage more people to screen, to take that initiative upon them to go and get themselves tested, screened, and do their health checkups regularly, so we can detect cancer earlier and then give them a very, very high chance of survival if there was a malignancy?
So I would say before going for a checkup, I think first we can do a lot more in terms of prevention. That should always remain very central to all the whole of the oncology world. And as we just started in the beginning, we said that almost 50% is preventable. So we should not forget the value of that if that 50%, if just play out 10%, that itself will be a big step.
Yes.
20%, 30%. So we can keep working on it. So that is first thing. If we have to really serve the society well, this is one area which we needs a lot of focus, and a lot is possible there. Now, as far as the screening and early detection is concerned, there are a lot of questions and queries in terms of value for what are screen detectable cancers which can be screened, and how to do that. I think we have to work at all three levels. One is the grassroots level, the public at large. So unfortunately, because cancer does not have unique symptoms, so people do not, this doesn't get noticed. A mouth ulcer can be a benign ulcer, a breast lump could be a benign lump, and so it doesn't get stand out that okay, this is cancer at this point. No. So the pitch which we keep talking about is that anything beyond 3 weeks should go for a checkup to rule out cancer, because most of the natural things or the self-limiting things will wane off in 3 to 4 weeks time.
Right. Okay.
So anything beyond 3 weeks, go for a checkup, rule out cancer. That is one thing. How to make it happen? I think we have to work at the general practitioner level or primary care physician level. We have to work at the society level. And fortunately, today, because of the easy access and internet availability, these campaigns are possible. The good thing is that today in the working class, even in the government sector and private sector, a lot of screening and a lot of health provisions are getting embedded. In fact, the Ayushman Bharat scheme also is helping a lot of people on ground to get treatments, at least full treatment. So as we go to that level, the next level will come. Even the government of India has brought out the schemes for mammography and biopsies and early detection centers. So these things are again work in progress. But to give a one line answer, I would say that we have to work with people and with primary care physicians to rule out cancer for anybody who has symptom beyond 3 weeks. That is one thing which we can work on.
That's great to hear, because that's such a it gives someone an idea, because like you said, a lot of people feel symptoms, a lot of them ignore it. So I wanted to actually probe you a little bit on this, because it could help a lot of people. So when you say symptoms, I know it's very difficult to give us a list of symptoms, but can I identify that as anything that's uncomfortable that we haven't experienced before? What
So
can
there
we?
are only about 10 to 15 symptoms, Samara. There are
Okay.
not more than 15 symptoms. There are very few symptoms.
Okay.
Bleeding or abnormal discharge, or from the rectum or vagina, or in the sputum, or cough or change in voice, and any growth, anything which is noticed, any alteration in bowel habits. We put all this together. So on the face of it, we have got 15, 20 symptoms.
Okay.
So what you are saying is also good, that if you are feeling uncomfortable with anything, so all these things will make you slightly uncomfortable or get noticed.
Absolutely.
And behind there, there are thousands of diseases.
True.
Now, on one side, there can be, for example, let us talk about bleeding per rectum. Yeah, that's blood in the motion. Now, without even any workup, people label piles and hemorrhoids and all that. Nobody will check out, and they will start taking some medication from somebody who has not even seen the patient. Just some other fellow will go and take a start taking medication for that. So if we develop this approach of evidence based treatment, that means you have to have an evidence before you start treatment. Then there'll be more and more people who will pick it up early. The most common example in our country is lung cancer. Now, lung cancer in India gets diagnosed in 90% plus people at stage 4.
Yes.
And the main reason for that is that any shadow in lung is taken as tuberculosis. And so the TB treatment starts by the patient and by the physicians, and that is the because the fear of TB is so much. Now, if we start doing that, unless you have a sputum examination or do a baseline CT or whatever, do some basic 2 3 tests, you can't start ATT. Things will change and change rapidly. So the whole idea is that anything you're uncomfortable with, anything which is new to your body, even one episode should raise an alarm. But anything which happens in a span of 3 4 weeks or maybe a month, again, please rule out cancer. It may quite often sound overboard, going too far for a very small, innocuous looking test, but that is, you're not paying the price there. But not going for the test may be a very heavy price to pay 3 months later or 6 months later.
So it's worth doing the additional test to just make sure that you're ruling out cancer in some way, shape, or form. Because as we know, detecting earlier is the answer to um, higher survival and longer survival and a cure, essentially. Dr. Harit, thank you so much. I've taken more of your time, but you left us with such important points, especially what you just mentioned about the symptoms and how to actually assess yourself and check yourself, because this is going to make a huge difference for even me personally. I didn't know this, to a lot of people. And this is what makes the difference and the change for people, because more and more people hear this, more and more people understand the importance, and then go do what is essential for themselves. Thank you for sparing the time. I know you're
Thank
extremely
you for
busy.
having me. Very grateful for this opportunity. Thank you. And I'm sure you will change this world and make it a much better
Oh,
place.
God. And likewise, Dr. Harit, likewise. We hope you enjoyed this episode and found it useful for yourself. For more such episodes, please subscribe to our YouTube channel, Apple Podcasts, Spotify, and Log Media website, where we dive deeper into the world of integrative oncology and healing cancer the right way.